You live in a rural setting. You have a spouse who doesn't necessarily want to take care of his health. And we all have habits. How do we use all this to help your spouse? We have good habits, we have bad habits, and we teach people to develop habits. You're in a rural setting, you're worried about your health, you're worried about his health. You need a habit of figuring out how to monitor and be aware of the symptoms and signs of diseases. And I'm going to talk specifically about heart disease. Everybody worries about it. What habits can you build around heart disease? You should be able to monitor yourself when you need to. You should be proactive about monitoring yourself as a habit so you can compare yourself over time. Your husband needs to develop the habit of checking their health when you're around and when you're not. So first habit, make sure that he does it when you're there. Use a device or a system that can track accurately what happens over time, and then have a plan that when you see the signs and the symptoms of heart disease coming up, that you know what to do with it. Have a doctor available. Consult a doctor about the habits you're going to build. Develop monitoring using tools that are recommended by people. Do your research, as you're probably already doing. It's important to assess and to be aware with the right information so that you don't look for the wrong signs or respond to the wrong changes. If your husband's important to you, treat him like he's important. Encourage his good habits. Coach both of yourselves adopting these approaches because your health is just as important. When you're traveling, those habits can follow you. You may be on vacation. You may be visiting friends. You may be on a cruise ship. One of the ways to be aware of heart disease is to look at your ECG, your EKG, your electrocardiogram. All of this will give you an assessment of your heart's health using the most commonly implemented cardiac test in the world, an ECG. It now can be done in your home with consumer-based technologies. You take a reading, it tells you your heart rate, it shows you the rhythm or the rate of change or consistency in your heart rate. And you can also look at the shape of the ECG that can give you signs that things may be changing. An example would be with heart failure. Over time, as heart failure progresses, the ECG changes. You may have arrhythmias, which will be seen as faster or slower heart rates or irregular heart rates. Atrial fibrillation, very commonly talked about today, is an irregular heart rate that can then lead to stroke. You're at 5 times risk of stroke with atrial fibrillation, and you can see this if you had the habit of looking at your ECG on a regular basis. You can look when you're feeling well, and you can look when you're not feeling well. What's important is you have a habit of checking your health and monitoring yourself over the long period of time, and then having a plan of action if something changes. Take the initiative, take control of your health, live better, live longer.